Good morning, teacher Janae. Today, Winston Song and we're going to present about the health coverage from a national and global perspective. Okay, I will talk about healthcare in Panama. Okay, healthcare is the improvement of health via the treatment, prevention of diseases, illnesses, injuries, and others. In Panama, healthcare are being underdeveloping since the past 10 years. Healthcare in Panama are based in the Ministry of Health and Social Security Fund, which contribute to the 80% of the medical attention to the citizens in the country. But Panama healthcare are focused on the capital. The lack of capital presented in Panama is not enough for everyone to have the right medical care. Places such as Chiriquí, Boca del Toro, Darien, and other places, they cannot have the same health care, so their life expectancy are much lower than the citizens. Okay, here in Panama, as in other countries, they are divided into public and private services. Within the public are the services that the CSS and the Ministry of Health for the rest of the population. Okay, this is the icon of Ministerio de Salud, and this is the Caja de Seguro Social. The services insured and are insured and uninsured. In Panama, there is only one public hospital, which is the Santo Tomas. It is the largest public hospital that the Panamanian Health Ministry has. There is a great deficiency at the public level. The CSS are mainly used to attend the retirees and the people who pay taxes. The people who don't have money or not working, they are not able to attend as faster as the others. In the indigenous reserve area are the hotspot in the infection of tropical diseases such as chikungunya, dengue, and malaria, and account for a greater percentage in death due to such diseases, as there is different access to medical centers. The healthcare in Panama are focused on the capital, which the medication for advanced and complex illnesses are not available, and this is the reason why the life expectancy of the people from the rural area are lower than the people from the urban area. Okay, as insufficient medicine catering is presented by the health entities, there are 85% of the attended people are receiving medicine in the CSS. There are not enough of doctors or nurses to serve in the CSS, which makes the patient not attended in time. But the overpopulation in Panama, the death rate has increased in the past 10 years from 3.76 to 4.73. In the urban area, population growth and rising family incomes are two factors driving up demand for health services and putting additional pressure on the care system, which is characterized by crowded facilities and long waiting period for surgery. Healthcare attention are received by 90% of the population. Nevertheless, the remaining 10% comprises of the indigenous inhabitants who have limited access to the health centers and medicine due to the geographical obstacles. Over the past 5 years, the government have introduced more medical devices to Panama from other developed countries such as United States, Ireland, Sweden, France, which are considered as the country with the best medical care. In Panama, there are approximately 15.9 doctors and 13.6 nurses per 10,000 people. These stats, which are superior to the global average requirement. Although the statistics are superior to the global average requirement, most of the doctors and nurses work for the capital. In the rural area, the medical care is not developed as the urban area, and the time that attend is longer because there is not enough of doctors and nurses, which makes a long period of waiting for surgeries. In June of 2016, the emergence of the diseases called H1N1 caught the country by surprise. This was because of the lack of preparation that the government was experiencing. The government did not plan enough to prevent the awakening of the H1N1. There were 64 deaths and 4,150 hospitalized in Panama caused by the influenza H1N1. The lack of injection caused the Meduca to have to suspend the classes for 2 weeks, waiting for the injection to come from France. The infrastructural conditions of the public health centers and hospitals are poorer than the private institution. People with good economic capacity would often visit private healthcare entities rather than the public healthcare provided by the government. There is an unbalanced distribution of modernized hospitals over the country's regions. Most private hospitals with modern equipment and good infrastructural conditions are located within the capital Panama City and in La Ciudad de David in Chiriquí, in regions apart from the capital city, so called the interior. The only medication attentions are realized in medical center or centro de salud, which medication for advanced and complex illnesses are not available. Okay, the solution. Resolving the healthcare issue in Panama is not easy, but it is possible. There are several solutions for the healthcare in Panama, such as importing enough of vaccines and efficiency distribution them to every health institution so that there are enough of quantities for citizens who wish to vaccinated. Okay, import more medical devices from the developed country with fabricate technological devices for medicine uses. Okay, the CSS should advocate health consciousness through propaganda such as short videos in different communication media so that people take more serious their health care. And there are many other possible solutions. Thanks.
Right now I'm going to talk about healthcare from a global view. As my partner has been emphasizing the lack of development in the healthcare sector of our country, right now it is important to remark the fact that universal health coverage has not been achieved yet by most of the countries around the world due to many factors. One of the major factors that influences the occurrence of such social problem is the differences between communities, cities, provinces, and even between countries. With this in mind, I want to present my thesis statement, which is the main argument of this speech, that states that there's a notorious tendency of a polarized healthcare system presented by different countries, not only the ones in America, but also the ones from other continents in this planet. And here I have the definition of what really is universal health coverage, that says all people receive the health services they need without suffering financial hardship when paying for them. And let's pass this slide. Health and its relation to health systems. Stay healthy all the time and receiving a periodical health care is probably the primordial thing a person should care in his or her daily life. The importance of such aspect is strongly associated with the healthy and proper development of human being, and thus any alternation and abnormal change on this would affect directly a person's daily activities. This is simple logic that does not require any scientific proofs. However, but do require extensive research and analysis from diverse professionals is the question of why there is still a great population in the world that do not have a healthy life. Well, from our point of view, this is closely linked to a good healthcare system. In fact, according to the long-term research of the WHO, which stands for World Health Organization, the health and well-being of people around the world depends critically on the performance of health systems that serve them. However, the performance of each country varies due to the fact that they are either underdeveloping or developing country. The European countries tend to have a better healthcare system than the rest of the continents due to the fact that most Western and Nordic states are already developed countries with concrete infrastructures. In contrast, most African and Southeast Asian countries are ranked at the lowest categories of the health performance ranking realized by the WHO. This is mainly because there's either a lack in development of any field. And here I got a table from extracted from the WHO database, and here it shows the top 14 positions and the last 14 positions in the health system ranking realized by the organization. And as you can see here, most of the top 14 countries are from Europe, and most countries of most African states, they're ranked among the last 14 places in the ranking. A graphic from the WHO that states the 6 minimum requirements in order for a person to stay healthy, which are: can you get help from well-trained health worker? Second, can you get treatment that helps you to get better and that is safe? Can you get the medicines and other health products you need? Who will pay for it? This is a very important point. Are there any policies in place to make quality services available to everyone, every time? And lastly, does your government have the information in it to make the right decisions about the whole system? And well, the differences in terms of economy, infrastructure, resources, education, and politics between countries have been the clear obstacles on the path towards reaching the universal health coverage for many governments. In order to achieve such objectives, the government should be able to put in work these 4 points, which are the well-trained medical personnel, reliable information and coordination for the system to function in an efficient way, well-maintained facilities and logistics to deliver quality medicine and equipment, and a very solid and flexible economic base to support the health system. These 4 points are pretty much summary to the previous points I have mentioned. Well, the most countries encounter difficulties in matching the last requirement. In fact, this creates a weak healthcare system that could not support the medical necessity of the residents and monitor the country's health situation. And this will eventually lead to a high expenditure on healthcare and medicinal attention, including medicines and logistics from part of the residents, but not the country. And here I got a map showing the expenditure, the out-of-pocket expenditure from the residents spent on health attention and medical necessities. And the blue color remarks the countries in which the residents have to pay the less on healthcare. And as you can see, there are mainly North American countries, European countries, some part of Asia and Oceania, which are New Zealand and Japan, and here last even South Africa. On the other hand, it is essential for a country to withstand unexpected attack from diseases or pandemic. Most countries in the world do not possess a suitable and well-prepared health system that could force diseases to come to a halt. This is mainly present in the developing countries, and there is a strong prevalence in African countries. The main reason is clear. There's a lack of development in all fields, and access to healthcare is centralized in big cities of the country, usually in the capital city, and this causes that there's a severe consequences such as absence of medicines, medical personnel, and equipment in the rural areas which are far from the capital city. And well, here I got a map showing the prevalence of the virus HIV around the world. And as you can see here, the HIV prevalence is mainly found in the African country. Like most they are concentrated in the southern part, which consists of South Africa, Zambia, and other countries, with apparently has a very weak healthcare system and not very efficient healthcare system. And well, some possible solution for this problem is for the worldwide country first, increase cooperation with the health organizations such as the WHO, the ICRC, which stands for International Committee of Red Cross, the UN, and others. Also, it is important to incorporate health education to the actual educational system, increase national expense on healthcare, as well as increase international collaboration on areas related to healthcare through treaties and agreements on supply of equipment and personnel. And well, here these are the sources from which we extract our data of our speech. And thank you very much for your attention. I hope you enjoyed the video. Thank you.